Hair loss, also known as alopecia, refers to loss of hair from part of the head or body, is common yet distressing condition that affects young as well as older individuals. Hair is made up of a protein called keratin that is produced in hair follicles in the outer layer of skin. As follicles produce new hair cells, old cells are being pushed out to the surface of the skin at the rate of about 6 inches a year. The hair you can see is actually a string of dead keratin cells. The average adult head has about 1 lakh to 1,50,000 hairs and loses up to 100 of them a day. Finding a few stray hairs on your hairbrush is not necessarily a cause of alarm. Malnutrition is the first and foremost cause for hair loss. Nutrient deficiencies like biotin, protein, zinc, and iron. Next one is hormonal imbalances caused due to polycystic ovarian disease. Medications like blood thinning medication, oral contraceptives, drugs for depression, anti-inflammatories and beta blockers, calcium channel blockers, too much of vitamin A and vitamin A based drugs called retinoids, chemotherapy used to treat cancer. Thyroid problems cause thinning of hair. Scalp infection due to tinea capitis or dissecting cellulitis of the scalp. Folliculitis from various causes, especially Demodex folliculitis caused by Demodex follicularum. It's a microscopic mite that feeds on sebum produced by sebaceous glands and it's not present on all the scalps but present on oily scalp. Denies hair essential nutrients and can cause thinning. Secondary syphilis. Excessive stress can also cause hair loss. Simple measures to prevent hair loss. Be gentle with your hair. Use a detangler and avoid tugging when brushing and combing, especially when your hair is wet. A wide tooth comb might help prevent pulling out hair. Avoid harsh treatments such as hot rollers, curling irons, hot oil treatment, and permanent hair straightening. Limit the tension on hair from styles that use rubber bands, barrettes, and braids. If you often wear your hair tightly pulled back, the continual pulling can lead to permanent hair loss. Protect your hair from sunlight and other sources of ultraviolet light using head caps. Stop smoking. If you're being treated with chemotherapy, ask your doctor about a cooling cap. This cap can reduce your risk of losing hair during chemotherapy. Avoid washing your hair with too hot water because this can break the protein strands in your hair. Medication for hair loss. Minoxidil is available in form of topical solution and is to be applied only where your hair need to grow. Finasteride and oral dutasteride are helpful in growing your hair taken orally, but they have serious side effects on sperm count. Diuretic spironolactone can also be useful in growing your hair. When your medications bother you, you can go for hair transplant surgery. Use shampoos which contain keratin. If your hair loss is caused by underlying disease, treatment for that underlying disease is necessary. If a certain medication is causing the hair loss, your doctor might advise you to stop using it for a few months. Foods rich in keratin and biotin that helpful in growing your hair are almonds, carrots, avocados, blueberries, cinnamon, coconut, dark chocolate, boiled eggs, pumpkin seeds, cooked spinach, sweet potatoes. Do not consume raw eggs because they contain avidin which interfere with biotin and cause hair loss. Thank you all for watching my video. For any health queries you can mail me.